we're talking a little bit about what's new, what's going on from kind of energy-based devices, some new injectables that we're involved in. Hello, and welcome back to your favorite podcast, Beauty in Bloom. As always, I'm your host, Dr. Jason Bloom. I'm a double board certified facial plastic surgeon in the Bryn Mawr, Pennsylvania area, right outside of Philadelphia. And today, I'm joined with two of our wonderful nurse injectors, Simone Talmor and Lily Marquez.
Hello.
Hello.
Good to see you guys.
You too.
Likewise.
All right. So today we have kind of like an interesting hot topics, podcast about new technologies, new treatments here at Bloom Facial Plastic and Aesthetic Surgery.
Yeah.
So we're talking a little bit about what's new, what's going on from kind of energy-based devices, some new injectables that we're involved in, and it'll be kind of exciting.
Yeah, it is really exciting because you always get, first dibs on it. Yeah, the new goodies.
Yeah, I have to say, because I've been involved with a lot of these companies, from a research and development standpoint, a lot of the injectable companies will come to us. They want us to try out their new products, give them feedback, which is great. And also new, energy-based devices. We try to stay on the cutting edge here in our office. We're not going out of, getting crazy and bringing on stuff that isn't tried and true and tested, but we do like to stay on the cutting edge, and I like to bring the newest technologies and treatments to my patients. And usually, if there's one office in the Philadelphia area that gets everything first, it's usually us.
Yes. And our patients know that. They're excited.
So true, right? And when we're testing out a lot of this stuff, we do, giveaways and trials, and we have, we like to use our patients that come in and get treatments as our models when we're demoing a lot of the new devices and things.
Yep.
So with
First
that,
up,
let's talk about some of the new stuff. Lily, talk about some of the new treatments and things that you're doing.
Well, the newest one is XERF.
We're going XERFing?
Everybody's XERFing.
Oh my God, don't do that.
XERF's up?
Yeah.
No?
XERF's
Is
up.
that not
I think
cool?
I think we need to do a video with that. But so Kim Kardashian actually posted it 2 months ago, and everyone was asking about it. Everybody was freaking out, and then 3 weeks later we got it in our office.
Yeah, of course, in true Kim K style too,
Yes.
she says, "This is my favorite laser."
Yes.
Like, she has no clue.
Yes.
Yeah.
Because guess what? It's not a laser.
No.
Yep.
It's a radio frequency treatment.
And everybody's, their selling thing is it's a facelift. So everyone goes, that's exactly why Kim Kardashian looks the way that she does. And all the DMs that we got, especially once we announced that we got it in the office. I have patients that I haven't even answered yet because I've been getting so many.
Yep.
And
Yeah.
it's very exciting. And it's a tried and true technology, like you said. Radio frequency, it's not new. There was, correct me if I'm wrong, Thermage was radio frequency. So
Thermage was one of
the first.
Yeah, one of the original transcutaneous radio frequencies. That means that you put this on the skin, and radio frequency energy works by pushing heat energy into the tissue to get new collagen and elastin formation, to get contraction of the collagen fibers through heat.
Yes, and a big part of why patients loved Thermage and then hated it was because it was so painful.
Right.
But the results were stunning. Everybody loved. I've never heard somebody not be happy with their Thermage results.
The one other thing I would say about Thermage, which was really interesting, is it was very user dependent, right?
Yes.
So there's like a great practice of dermatologists up in Boston, and these guys do so much Thermage, and they are so good at it.
Yeah.
But like, you really have to
be
know
careful.
how to do it and do it well. And so, I mean, that has been one of the biggest knocks on a treatment like Thermage, is that you got to know how to do it. It's not just 100%. Like something that you can pick up and treat anyone with.
And a big thing with radiofrequency is that people were worried about it dissolving facial fat. And actually, a really cool feature on the XERF is that once it gets to 43 degrees Celsius, if it goes higher, it automatically cuts off. So you're really not worried about going too hot to dissolve or melt any fat.
It
will cut the pulse, and it won't even complete it. So it's very safe, and it's very user friendly to the provider, and it gives the patients like a sense of security that they're going to get a great result. I love radiofrequency. I was a little hesitant, but after treating it, I'm actually really happy with like what I'm seeing so far.
And I think you like started your career at like a different office, and you were doing, and like they did like
a ton of radiofrequency,
a lot of radiofrequency treatments. And it's been a tried and true treatment. What's different a little bit about the XERF is that, and first of all, XERF, just for those of you listening, is spelled XERF.
Yes.
So it's like kind of, they had to be a little bit different.
A little trendy.
Is that it's multiple different frequencies at the same time. So you can go more superficial and have a deeper pulse at the same time to apply that radiofrequency energy to two different levels at once.
Yeah.
And then the first time that I've ever, we were talking a little bit about pain with some of these radiofrequency treatments, but one of the interesting things about XERF is that I would say, now I haven't had it myself, but in the patients we've treated, everyone's saying that it is significantly more comfortable than some kind of like similar treatments that we even offer at our office.
Yeah.
And that is because what is known as cryogen cooling. So cryogen is like freezing. It's like a coolant freezing spray.
Yeah.
And like a nanosecond before the XERF pulse, it sprays this onto the skin and actually freezes the tissue before the pulse happens.
Yeah.
This is the same thing as the DermaV,
right.
correct?
Yes.
Right. So we have other, like the pulse dye laser, like the V-beam, or the DermaV, all use cryogen cooling in order to immediately spray this on the skin the split second before the laser energy, or in this case, the radiofrequency energy, is applied to make it more comfortable when you're doing the treatments.
And it kind of confuses the brain too, because you're feeling the cold, you're feeling the hot, and by the time that you're kind of like, is this warm or not, the pulse is over.
It's done.
But I just treated one of the girls from the front desk, and she described it just in the lower area. She's like, maybe a 4 out of 10, like just in certain spots that's thinner skin, the face. And she's had like ultrasound treatments before. She said, I didn't even feel it. She goes, it was so comfortable. It was very tolerable. So that will definitely be a big selling point for patients as well, that they don't have to be in pain or uncomfortable during a treatment.
It's definitely a game changer, because you've done soft wave on my face and also on my stomach after I had my son, and I saw the difference. But I tell patients, look, it's extremely painful. It's very, very hot.
Yeah.
Although some patients,
I've soft waved myself, and
it doesn't hurt at all.
I've talked through soft wave. Everybody has a different tolerance, but I definitely think that if I know for sure that my patients will get just as good of a result with this, and they're not going to be in pain.
The other thing that I notice maybe more with the patients that we've done with XERF is that Cinderella effect that I absolutely love. I mean, you see the immediate effect. So,
and it lasts for like 10 days.
I was just talking to a patient today. She's got her daughter's wedding coming up in September. I'm like, you need to do 2 treatments, and that second treatment I want you to do about a week right before the wedding, so you're ready to go.
Yeah, so the cool thing about it is there is literally no downtime.
None. You don't have to numb.
Similar with an ultrasound treatment that we have in our office called SoftWave, they both have no downtime. There is no numbing.
That's
the
huge.
treatment is half an hour to 45 minutes. And, you can treat face, neck, the whole area, jawline.
Forehead.
Yeah, it's exciting.
Yeah, it's exciting. I'm excited to get some really good before and afters. So we can show everyone.
Yeah, and you know, the interesting thing is, since we kind of like put it out there on social media, the buzz, I don't think I can remember an energy-based device with as much like buzz or social media.
Do you think that really
like,
just comes
interest
down from Kim K?
I mean, I don't know, but
don't
people
know.
are
Yeah,
just like
people are
calling
talking
and
about
asking for it. Like I was almost like forced to get it and buy it because,
So many
you know,
people are
like people
asking
are
about
like,
it.
well, why don't you have XERF? Like you get everything and you get it first, but like I heard it's great. Like why do you not have it?
Yeah.
And like I'm like, oh, okay, maybe,
like, I guess I
maybe
need
we
it.
should get it. Let
Yeah.
me look into it. And so after I did my research and talked to a bunch of people and talked to the team, that's why I ended up, you know, purchasing the device. But the amount of just hype and social media interest in it, I have really hadn't seen that in a long time.
I agree.
Yeah, it's
there's
exciting.
definitely a lot of buzz around it. So I'm excited for it.
People want things that, and especially coming into spring, summer, right?
Of course.
So when we're talking about energy-based devices that are, you know, can be when you're in the sun,
Yeah.
and to be able to go back and do things without any downtime and not like a laser where you have to be out of the sun,
hidden,
I think that's a huge benefit.
Yep.
Yeah. No, I agree.
Love.
I'm excited for it.
Cool.
All right. What's next?
All right.
Simone, tell me. I don't know. What's next?
Well, Super Shot, and I want you to kind of speak on that.
Yeah. So Super Shot PRP is really interesting because this was a technology. I'm an aesthetic tech investor. I have invested my own money in a number of different companies, and I like to invest in things that that make sense to me and are in a space that I understand. So I understand aesthetics, I understand regenerative medicine, and I met the chief commercial officer and later the CEO of this company. They're actually based in Ann Arbor, Michigan. Go Blue,
Yeah.
I'm a Wolverine, as you guys all know. And I was talking to the chief commercial officer, and the interesting thing is exosomes are really hot right now.
Of course.
Right?
Yep.
People are like, what is an exosome? What's in the exosome? Well, exosomes are lipid bilayer, basically vesicles. They're small extracellular vesicles, and they can be released by one cell and what we say exocytosed or picked up or like eaten by another cell.
Yeah.
And they contain micro amounts of important information, right? So it's on the very basic level, an exosome is how one cell communicates information to another
Like
cell.
a little,
Like little
messenger.
messengers.
Yeah.
It's exactly.
Yeah.
It's the
Yeah.
messengers. And the cool thing is they can contain micro amounts of RNA and information for healing
Yeah.
and various growth factors and things like that to speed up healing. So, and we carry Plated, which
Yeah.
is a great skincare line, which in full disclosure, I'm also an investor in.
Yeah.
It's a technology based in the Mayo Clinic.
Shout out
in
to Rochester, Minnesota.
Rochester, Minnesota.
Minnesota.
Yeah.
Okay, we don't do that, but yes.
So that technology uses exosomes from
Yep.
platelets,
Yeah.
right? So we use PRP and PRF right now currently in our practice we use it a lot for like hair restoration.
Yeah.
And sometimes we also use Invo exosomes for topically after microneedling treatments. Invo is also a local company. We're friends with the CEO. We're just trying to get this kind of healing information, and we include it with our treatments into the tissue after like a microneedling treatment. So when I heard about this company, she said, where are you currently using like PRP? And I said, okay, well, we do inject PRP in the scalp for hair restoration, and we've applied it, topically in some of our ablative lasers. Yeah. And she said, well, we'll go through the process. How does that work? And I said, okay, well, we draw the blood, and then you spin the whole blood in a tube, and what you get is the PPP, which is platelet poor plasma. Yep. You get the little buffy coat, which is kind of the separator. And then you get the PRP, right? And that's the platelet rich plasma. And then you get the red blood cells below that. Yeah. And she said, okay, that's great. Okay, what do you do at that point? And I say, well, we take the small amount of PRP off. Yep. And we inject it. Well, she's like, well, what happens to the other stuff? And I said, well, we throw that out, right? And she said, well, that's where we come in. And the cool thing is we can utilize the PPP, the platelet poor plasma. And from there, through this it's actually like a mathematical equation. They figured out how to spin that. They have like essentially another tube that we put that in, and we spin it again in the centrifuge, and actually it concentrates the exosomes. So you're getting the extracellular vesicles from this platelet poor plasma that we would have thrown out anyway. Yep. And so we're then able to take some of that and inject it, apply it topically, and it's autologous. Yep. It's from your own blood. Yeah. So it's the first time that exosomes are going to be available in the United States without from like pooled platelets or exosomes right now are from regenerative tissues. So platelets, they're from Wharton's jelly from from pregnancy. They're from placenta. They're from fat, adipose-derived stem cells and adipose-derived exosomes. All these different things. The cool thing is in all those cases, they're pooled. They're taking it from pooled donors.
And that could be like an ethical issue for
right.
certain
You don't know that. And that right there is why the FDA has never approved an exosome to inject. Yeah. We don't inject exosomes in this office. Nope. We apply them topically. Except, and I will say, right now, the FDA is looking at this process that I just talked about in order to approve the first injectable exosome in the U.S. because it's autologous, meaning it's from you and you're getting your own exosomes. Yep. So there is one clause of this regenerative medicine aspect where the FDA will allow, they just consider it, you can inject basically autologous blood products. So you can inject PRP and PRF based on good, reasonable data, and that's how the FDA looks at it. So because it's autologous coming from yourself and your blood going back into you, the FDA lets that go. Yeah. But now to have the exosomes be able to be injected because it's from you and from your own blood, that is exciting.
Yeah, it's highly concentrated, right? Like 400 billion exosomes. I mean, it's
some crazy amount.
It's a ton of exosomes. And
and it only takes like what, 5-6 minutes to
an extra
create,
5 minutes to add on to the appointment time. It's really quick.
But a game changer, hopefully, especially in the hair restoration world.
Yeah. So that's really exciting. Hair restoration or even topically applied after lasers and things. And I'm just hoping in the next couple weeks to months that the FDA approval does come through with this.
It would be odd not to.
Yeah.
Right? It just makes sense. Like if it's coming from you, like you can, it's not coming from anybody else or anything else.
So, I mean, it's cool. So the company is called Super Shot PRP because that's what it's doing. It's taking your PRP and supercharging it.
It's like on
just
steroids.
making, exactly.
PRP on
it's just
steroids.
making it better.
Yeah.
And so that's really exciting. I'm excited to offer that. I know we are the first practice and really probably only practice in the Philadelphia area that offers that.
Shocking.
Yeah.
Exactly. So,
all right.
What else is going on?
Magic, baby.
Yeah.
Magic? What do you mean? Magic wand?
You know it, Harry Potter style.
Well, I mean, kind of. The little magic
Obagi
syringe.
has created a filler.
Yeah, the skincare line is now getting into injectables. So
it's very interesting. This is actually one of the newest FDA approved fillers in the United States. And
when did it get approved?
It was actually approved years ago, like maybe 23 or 24.
Okay.
Wow, okay.
And it was approved when a company that owned it was called Chroma, and they're a global company, and they had the rights to this filler, and they kind of like gave up on the filler. And a friend of mine who has worked for a number of different aesthetic companies, he worked for Galderma, he worked for Allergan, he was in the PE roll-up space of med spas for a little bit, and he became like the chief commercial officer of Obagi. Once Obagi or Waldenstrom they kind of acquired Obagi, and they decided to acquire the rights to this filler.
Okay.
And the cool thing is, I don't think they're done. And what I mean by that is, I think they're going to be acquiring other things potentially. They're looking for other acquisitions, but Obagi has had a strong name in aesthetics, in beauty for a long time, right?
Yeah.
Everybody knows this.
Obagi.
They have a lot of great skincare products. Well, now they have their first FDA approved filler, and we, as part of this office, are part of the Aloha the Aloha program. So that's aesthetic leaders in Obagi hyaluronic acid. Okay. And so what they've done is they've provided us with the syringes of these fillers. And you know, Simone said magic because that's the name of the filler is MAG IQ.
Yeah.
So
I really
magic.
do want it to be magique.
I keep sounding like it's our new
magique.
magique.
Yeah,
it just
sounds
like
sexy.
better.
It does sound cool.
Make it
Whatever.
a thing.
Magic it is.
But they provided us syringes of this filler, and they want our feedback in the real world.
Yeah.
How we're using it, what patients we're using it in, like how many syringes does it take to get a good, you know, a good outcome in the lower face, or what we're using it for. Right now, it is FDA approved for nasolabial folds and other folds of the face, right? As are a lot of the other fillers. But in the real world, we've been injecting it in a bunch of other areas. You said you've injected it in lips before.
Yeah.
It is
Looks
approved
great.
in some of the other countries in the lips. And I would say for injecting it now for about a month or so, I think the Aloha program started in January. We've probably been injecting it for about 2 months.
Yeah, I've been liking it.
Yeah.
Yeah, it's very consistent.
It is.
And so some cool things about it are the cross-linking, which is how modified the product is low, which means, God forbid, if you needed to dissolve it or get rid of it for some reason, that means it's safe. You can get rid of it easily. It's very consistent, I think, in the injection.
It is.
I think it's very smooth.
It's easy to push.
It's easy to push. The syringe is really nice and ergonomic, makes it easy to inject. And I would say, I told, you know, my friend who is, you know, the chief commercial officer, I said, it's a great all-around utility filler.
It is.
Agree.
Yeah.
So you can use this in, nasolabial folds and marionette lines. It's great kind of if you're looking for something that does a lot. It's very
versatile.
It's versatile. That's a great word for it. It's versatile and a great utility filler. And the cool thing is when you're looking at it, this is kind of like from the nerdy sense that I look at is each of the fillers have like a particle somewhat, right? So some of the particles are like ripped off. Some of them are more consistent. This has a consistent particle size. And because it's smooth and consistent, the body doesn't look at that as foreign. The body looks at that as, as more like natural hyaluronic acid. So that is
Less
exciting. There's always ways that these companies are working to make the products look more natural. And I think we're even going to talk about some other products too. But this is a great utility filler. We're giving the company back, feedback, and our patients have been liking it.
They've been really happy. I've been doing a lot of lower face with it, and the patients are really happy. Yeah. And you don't need a lot. Yeah. It makes a big impact with just like one syringe.
Yeah. Totally. Yeah, I think it's been pretty exciting. What I also, and this is kind of like exciting for the future, what I'm also excited about, probably an FDA approval towards the end of the year or potentially next year, but maybe even towards the end of the year, is their mid-face product, which is going to be called Chic, CHIQ.
Oh,
cute.
Yeah.
Magique and chic.
I know.
I want to add like a little French accent.
I know.
Right?
Same.
It totally
like
makes
that.
sense. And the
when are we getting our hands on that?
Well, it has to get approved first, but the products are like are manufactured in Vienna, Austria. That's where their plant is. But really exciting.
No, that is
exciting. When do we get to go visit the plant?
I don't know. Do you hear that, Drew?
Yeah.
You listening to this podcast?
Go around Christmas.
When are we going to go visit Vienna?
All the markets.
I love that.
We just great minds think alike.
All right. What else?
All right. Well, I would say it's not new. We've been offering it, but the nurses just got a great new training on it. So CO2. Yes.
And another device, another Lutronic. Because
I know, because
you guys were hogging it at the surgery center.
I know. We just got a new. Exactly. Yeah, we got like a new laser. So another laser, I should say. So now we have 2 CO2 lasers. It's just a great overall, very aggressive, fractional ablative
nice
laser.
To be able to offer a more aggressive treatment, those that are willing to deal with the downtime.
Yeah.
Well, you know me. I like anything that causes blood or smoke in the office.
It's actually it's really cool. Like when you're doing it, like you just get into a mode where you just like want to create these beautiful lines, and it's just like dead skin's just floating away, and you're just like, this is going to look so good. Yeah. And it's for patients that they have significant damage and they have deeper wrinkles, and a laser, even like Halo's, not going to cut it. Yep. And they can give you that 2 weeks. I always say 2 weeks. Normally it's like 7 to 10 days, but it's about 2 weeks.
I would say 1 week of,
looking
so
scary.
For example, like I was at the surgery center this morning and I did a facelift, brow lift, upper eyelids, and then I did a CO2 laser on her under eyes.
Yes.
And when I'm using it in conjunction with surgery, which is why. So we had the Lutronic, it's Cynosure Lutronic ECO2.
Yep.
And it was the first CO2 laser I bought. It has been a workhorse of our practice, and especially at the surgery center for many years. And then you guys, all my nurses and PAs, wanted to offer this treatment, and we were like, for a period of time, we were rolling it back and forth.
Scariest,
from the surgery center. I was like,
walk.
Do not let this fall. Or
everyone's like walking like this.
Exactly.
No.
So they did come out with the updated version, which is called the ECO2 Plus or ECO2 3D. Yeah. And the crazy thing is, it's now 40 watts. It's like stronger, And there's ability to do even a more superficial. And so I was like, gosh, 30 watts is super strong. Do we even need a 40-watt device?
Yes, we did.
The answer is probably not. I'm certainly not going that aggressive, but we have that capability.
Yeah.
So now we have the ECO2 3D for the office, and we have the ECO2 that I've always used at the surgery center, so that it can be utilized at the same time.
Yeah.
But I tell patients, this is a week of putting ointment on your face.
And doing soaks, and it's really patient. You have to take care of yourself like at home. Certain lasers, like you just put some skincare on and you go about your day. Like this is something that the patient needs to follow protocol very specifically.
Yeah, you're going to slough the skin.
Yeah.
It's going to peel.
It's going to look a little gross.
Yeah, and it's depending on how aggressive you go,
Yeah.
you're talking a good week of putting ointment on your face and then another probably couple weeks of pink redness under the eyes.
Yeah, exactly.
They can, after they've done that initial peel, they can be back in makeup, but it's important to understand and explain to patients that's how it's going to be.
You won't be camera ready for at least like 3 weeks.
Yeah.
I say 3 to 4 weeks,
really
depending on how aggressive
careful
you go.
about
but it's
being
a
in the sun,
fabulous
too.
laser that you really only have to do about once every like 2 years. I tell patients 2-3 years, depending on how aggressive you go.
Yeah.
So if you can give the downtime, it's a better bang for your buck, and it's just a better result overall.
We're constantly working to weigh effect and downtime, right? It's like if you want to make an omelet, you're going to break some eggs, right? And so to get better improvement, you're going to have more downtime.
Yep.
And so, like you mentioned Halo. I love Halo.
Yeah,
I
same.
think that's and what I've always said, and maybe you've heard me say this, I think Halo is the best outcome, the best laser treatment for the least downtime.
100%.
Agree.
Right?
Yes,
Agree.
And so we have Clear and Brilliant, which is basically like a day or two downtime for a good result.
Yeah.
But again, Halo's kind of in the middle.
Yeah.
CO2 is the best result, most amount of downtime.
Yeah. But
So
if they
it's
can
not
give
for
it,
everyone.
it's a great result.
Yeah.
Yep.
Yeah.
Definitely.
Love
All right. Evolus fillers. Smooth and
Smooth and
form,
form.
baby.
Smooth and form. Very interesting. So the company Evolus that we've carried Jeuveau in our office, which is probotulinum toxin, which is our a neuromodulator we use in our office. We actually like it because it's very precise.
Yeah.
Very precise.
I love it in the lower face.
Love it
So
in the lower
using it for
face.
like masseters, DAOs, mentalis, neck,
Platysma.
things like that. It's there's never been a study looking at the diffusion of this product. However, based on my clinical feelings about the product, I would say it's one of the tightest, most precise neuromodulators out there.
Yep.
So we've carried it since it's come out. And Evolus acquired the rights to the Evolus fillers, EVOLYSSE. Now, the interesting thing about this is these fillers are utilizing a cold X technology. Okay? And I'm saying fillers. Evolus doesn't like to use the word
I was
filler.
going to say they don't like the,
Right? They say this is a cold X hyaluronic acid treatment, right? So if on the basic level, when we think about these fillers, they're made up of hyaluronic acid strands. The longer that you can make that hyaluronic acid strand, the more the body looks at that hyaluronic acid as natural.
Yep.
Right? So when you cross-link fillers, some of the other companies, what happens is you put the filler with the base, which is saline, you mix it up, you throw in the cross-linker, and you heat it. It's like in a big vat, and there's a heat source, which is heating it up. Well, that heating process breaks down the hyaluronic acid chains into smaller chains. Now, it's still considered long chain, but by breaking it up, the body sees that a little bit more foreign. So these other companies are looking at ways to keep the hyaluronic acid chains intact. Some companies have done this in more of a sous vide technique under kind of like room temperature. Well, what the Evolus products have done is they're doing this product under cold, freezing technology, so that it can preserve the length of the hyaluronic acid chain length, and the body looks at it as more natural.
Less adverse effects, less inflammation.
Exactly. So there is, in the studies throughout the years, like there has been like very little to no delayed onset nodules or issues because the product looks so much like natural hyaluronic acid. The body isn't kind of like attacking it or having issues with it. I did a study as part of my the group that I'm in called Premier Aesthetic Solutions, and we did an advisory board for the company as well as a study that's currently in publication that we are publishing. But I injected a few patients, and everyone in the group injected a few patients. And what I can say in using these products, so there's Evolus Smooth, which is a little bit thinner. I like to say works well for lines.
Yeah.
And then some of the etched in lines of the face. And then there's Evolus Form, which has a little bit more oomph, which is more for folds.
Yeah.
What I was shocked by was how far these products went
I was just going to say that.
with a small amount of product.
It pops out the cheeks.
The form
like,
and the cheeks is stunning.
Yeah, I'm like, I love it for like the fold, and I was like injecting it, and then I'm seeing this result happen as I'm injecting, and I'm like, wow, that's like, there's still
a lot
more
left
in the syringe.
Yeah.
So like, what I've seen about with these products is that you get so much bang for your buck.
Yeah.
I've really been excited, and we've used a lot of them.
Yeah.
And just like, again, spoiler alert, but this is probably coming towards the end of the year or early next year. But just like Magic has cheek coming, the Evolus products have shape coming. And that is going to be their mid-face entrant into the mid-face filler category. The studies in both of these companies, the studies are done.
Yeah.
Right? They're like, the studies have been done in the U.S. It's just waiting for the FDA to look at the studies, to evaluate them, to make sure that they're safe and effective for use. And as soon as the FDA kind of like rings the bell and says, okay, these companies can start marketing them.
Are these fillers already in Europe and being used?
Yeah. So interestingly, right? Have you heard of the company Simites?
Yeah.
How do you know Simites?
I don't know. It just sounds like I've heard that
I feel
name.
like I've seen it,
Couldn't
like, on
tell
Instagram
you.
or something
Couldn't
like
tell
that.
you.
Guess
But
what?
Simites.
Simites. It's fun to say, right?
Simites.
Yeah. Simites is the original makers of OBT technology.
Oh.
Where does that
Maybe
sound familiar?
That actually does not sound familiar.
Okay, well, interestingly, OBT technology is the expression technology in Europe. So Restylane Silk. I'm sorry.
I'm surprised that doesn't ring a
Restylane
bell.
Kiss, Restylane Contour, Restylane Refine, Restylane Define were made as the OBT technology in Europe.
Okay.
So the same company that originally manufactured these Restylane products that we use, now called Expression Technology, manufactures the Evolus products.
I did not know that.
Interesting.
So Simites was the original manufacturer of the Restylane expression, but it was called OBT technology, and is now manufacturing these products.
That's interesting.
So it's cool. They understand how these. I mean, they've been around in manufacturing filler products for a long time.
That's exciting. Mm-hmm. I really like the products. They're really they make a big difference.
I really do too.
Yeah,
especially the cheek.
Yeah,
the cheek is beautiful.
I think the support. For some of the deeper folds, I still have my favorites that I use in the cheek all the time. But I'm impressed along kind of like in layering the Evolus form a little bit deeper and then kind of coming and touching up with the Evolus Smooth.
Yeah,
I think that's
and also Smooth looks beautiful on the lips too.
Okay. Cool.
Yep, I haven't tried it in the lips.
Yep.
I'm not a big lip injector myself.
You're not a lip person.
Yeah.
I send them to you
Yours,
girls because
exactly.
that's not my thing.
Yeah.
Any other kind of things going on, or
I feel like we touched base on all the new things, but I know patients will ask. We still love our Softwave. It's a tried and true. I know that my patients get fabulous results from it, and I will still be using Softwave in this practice.
Safe. It's effective, and the cool thing is, you are just. It does hurt,
but everybody's different because again, I didn't think it was that bad. Yeah.
I told my patient, I'm like, it was a 10 out of 10 for me, and she came back to me. She's like, Lily wanted me to tell you that I need to tell you it didn't hurt.
Yeah.
It's like 0 out of 10. I'm like, how did that not hurt you?
I know, and everybody's different.
Who hurt you?
Who hurt you?
They both. I think you both have.
Me, but I have a gentle touch, so you tolerate it a little bit better.
That's true. She does hold my hand a little bit better.
But no, we still love Softwave.
And Softwave is dermis, right?
Yes.
It's skin tightening.
Only dermis.
You're not going deeper to affect some of the deeper tissue layers.
You're not going to melt fat.
You're not melting fat. You can't. It's impossible.
Can't,
It is impossible to melt fat with a technology like Softwave because you're just working on the dermis and contracting that.
So just to reiterate, in case our listeners are still questioning, can XERF melt fat?
I think the risk is extremely
it will cut off. If the temperature gets too high, it will cut off at 43 degrees Celsius. It won't even finish the pulse.
All right, there you go.
So I think that the risk is very, very, very low, which makes me very happy. So we still love Softwave. We talked about the CO2. We still love Halo. We will be doing lots of Halo. It's
all day,
tried and true. We love our Restylane and RHA filler.
I have never had a laser.
I know, because you're a baby.
I'm a baby. I am. That's true. I haven't had a baby. And I haven't had a baby.
You also don't have a lot of downtime. You're like the patient. You just don't have downtime.
Yeah. But I think if I was going to just maybe in the fall or winter, just crush my skin once, I would do a Halo.
I knew you were going to say that.
It's on record now. You're going to do a Halo in the fall.
I said
it's not bad. It's not bad. It's really
You're going to do a Halo in the fall, and we're going to record it on the podcast.
You've seen me get neuromodulator in my face.
The thing is, the treatment itself is not painful. It's just afterwards you're hot for about an hour and a half.
Not 30 minutes.
Two of my favorite treatments, I love a hydrofacial.
God.
It's so
and you love
relaxing.
microneedling on 1 millimeter.
It's like you've microneedled my face a couple times.
He's like, this doesn't hurt. He's numb for an hour, and he's 1 millimeter, and that's it.
I once gave I think it was during COVID, I once gave a webinar.
Yes, I did it.
Online while holding up the computer while I was getting microneedled.
Yeah, we did that together.
You, right?
Yeah, and he's like, this doesn't hurt.
Hell?
But yeah, so
was that part of was that the point of the webinar, or were you just
it was just to go over it, and he was our model.
It was a skin pen precision. It was a skin pen webinar,
wow.
and I was giving the webinar while I was getting microneedled, just to show it doesn't hurt.
Yeah. Oh, but yeah, so we still have our tried and true treatments that we absolutely love, and we will pick the best one for the patient.
Yeah, absolutely.
Always open to new devices.
Yep.
Well, thank you guys for listening today. And I hope everyone knows that while we're bringing on lots of new technologies in the injectable world, in the aesthetics world, in the energy-based device world, we make sure that everything is safe and effective for our patients before bringing these into our offices. So, like always, thank you guys for listening. And remember, keep tuning in to Beauty and Bloom.